guys, welcome to the Inspiring Minds coaching. I am Shivam, educator here. And now we are going to move the next step of the pharmacological concept. As in my last video, I told you about the enzyme kinetics, the pharmacology. Now I am going to talk about enzymes, which is going to show their effect in the pharmacology. I have given this heading to the pharmacological concept of enzyme, or you can say pharmacological enzyme concept. Actually, the purpose of giving this video and this topic is very important and very much confusing for study, because what happened that in biochemistry also we study enzyme, and what we say that should be different, that should be same, but no, here the enzyme classification and their work and even their mechanism is somehow, or you can say, almost different. What happened? Just a quick revision that if you remember that in the biochemistry, Dr. Rishabh will talk about that in the video of biochemistry. He will tell you, or you know, that there are 6 classes of the enzymes in the biochemistry, but here only two classes. Okay, so I will just give you that exam, some hint that there was for hydrolysis, ligase enzymes, proteinase enzyme, DNase. So here is different. That was the molecular level interaction of the enzyme with the substrate, but here you are going to see their pharmacological effect. Means they are going to produce some kinds of clinical symptoms, or you can say physiological or pathological symptoms, right? So let's begin. Pharmacological, it means that it says about drug. As in my first video, I told about the drug, what are the drug molecules, and enzyme is that they're the basic structural component is always similar. They are the proteinaceous and protein derived molecule, a small biological molecule. And in the pharmacology, the enzymes are basically divided into 2 levels. The first one microsomal and second one non-microsomal. What about microsomal? Actually, what happened that when we study about the enzyme, so in the pharmacology we always interested to learn about their interaction with the drug and causing their effect. So here microsomal means that there is a living cell, and this living cell having nucleus, eukaryotic cell having nucleus, endoplasmic reticulum, mitochondria, and ribosomes and other cellular granules. Inside a cell there is a structure that is found is known as microsome. Somehow you can go to the more specific, the lysosome, that also contain enzyme, but that is not microsome. Microsome, you can see the small droplet kind of structure which is found inside a cell, eukaryotic cell, and they are basically 2 types of enzymes found on the basis of the pharmacological dynamics or pharmacological effect. The first one is inducer and second one is inhibitor. Inducer, as name itself says, that when there is any byproduct production, like in glycolysis, or you can say EMP pathway, or you can say in other like fermentation reactions, so there is some enzymes which promote their effect. Okay, they just induce, and in the pharmacology you will study that is very famous, that the formation of dopamine from when levodopa drug is given in the inactive form, and it substrate produce the dopamine, right? So that is in active form and active dopamine is produced. So here inhibitor is another function. In inhibitor concept, we give the drug to inhibit some kinds of enzyme. In case of arthritis, xanthine oxidase enzyme, I think in the biochemistry you have learned, and their allopurinol is given to suppress its activity. So it means that we are giving an inhibitor. So inhibitor, enzyme inhibitor, right? So we will talk about enzyme inhibitor and enzyme inducer. To be more precise, when we talk about there is the enzyme, but here we talk about drug as a enzyme inhibitor and enzyme inducer. They will increase or give the pharmacological effect, right? अब है क्या कि एंजाइम का माइक्रोसोमल और नॉन माइक्रोसोमल में अगर हम इससे क्लासिफिकेशन पढ़ लिए, जब ड्रग, व्हेन वी टॉक अबाउट द ड्रग मॉलिक्यूल्स आर सो सेलेक्टिव and they should be in small quantity. Later I will tell when I will start the pharmacokinetics, but before that I want to make a basic concept should be clear, right? So here that enzyme acting or the drug acting over the enzymes are the basically two types. Either they are going to induce their effect or they are going to reduce their effect. Inducing effect is known as a drug, that is an enzyme inducer, and negative one, that is inhibitor. I have mentioned it with the mnemonics, that is GPRS sulfone. There are these drugs and function which is very famous to when we talk about the enzyme activity or drug activity. So there is a drug, okay, and what these drugs do, these drugs have effect over the cellular level molecular mechanism on the name of the enzymatic activity. The GPRS cell phone and here mnemonics is given for the G for griseofulvin, P for phenytoin, and R for rifamycin. This all will come. As for smoking, this is not a drug. Okay. C for carbamazine, and phone P for phenobarbital. This one is also very important. Okay, and in the enzyme inhibitor form, we have vitamin K cannot cause enzyme deficiency. Itself is a very important thing when there is increased production of the vitamin K. So definitely it is not going to show the inhibition effect, that will be inducing effect. Why? I will just tell in my next video. Till then I will just let you think that why. So here vitamin V for valproate and K for ketoconazole, then again C for cimetidine, and again C for ciprofloxacin, and enzyme erythromycin and isoniazid. Ciprofloxacin itself is a very famous drug as antibiotic. It is given. I also mentioned in my microbiology lecture. There ciprofloxacin as an antibiotic and erythromycin also antibiotic, especially in case of gram-negative bacteria. Okay, so enzymatic drug acting over the enzyme is somehow so much important to learn, and here one short thing which is every time, or you can say universally it is applicable, that most of the time anti-epileptic drugs or the enzyme inducer and antibiotics are the inhibitor. See, inhibitor. So we can make a small conclusion that most of the time antibiotic are the enzyme inhibitor, and most of the time anti-epileptic drug they are the enzyme inducer. Okay, so this one was the short, and also it is very important for you to remember, because a question have been asked from rifamycin, phenytoin, and also phenobarbital. Okay, and from enzyme inhibitor, most probably it has been asked from antibiotic section, and also this one also asked one time. So guys, here a small pharmacological concepts is finished. In the next slide I am going to give you the basic introduction with the pharmacokinetics, and I will go their steps like absorption, distribution, okay, metabolism and elimination. Enzymes are the very important, or you can say they have the prominent effect over the metabolism of the drug or metabolism of the substrate. So this you will learn in the section of metabolism in the pharmacokinetics. Okay, so let's move to the next slide. So guys, now as in the last slide we saw that enzyme pharmacological concept of the enzyme. वहां पर हमने ड्रग की एक्टिविटी देखी एज एंजाइम इनहिबिटर, एज एंजाइम इंड्यूसर. Okay, and remember the mnemonics, that is GPR cell phone, another vitamin K cannot cause the enzyme inhibition. Okay, निमोनिक्स जो है वो यूज होता है, वो आपको बस इतना ध्यान रखता है कि वो नेम क्या थे, उसके टर्म के अकॉर्डिंग आप उसको याद कर सकते हैं, बट दे समटाइम्स आल्सो हेल्पफुल टू सॉल्व क्वेश्चन विद इन अ टाइम लिमिट. सो नाउ इट्स अबाउट द फार्माकोलॉजिकल कंसेप्ट. ये बहुत छोटा सा पार्ट है लेकिन बहुत इंपॉर्टेंट है, क्योंकि इसी के जस्ट बाद स्टार्ट होता है फार्माकोकाइनेटिक्स. अब फार्माकोकाइनेटिक्स स्टार्ट करने से पहले मैं ये यहाँ पर इसलिए मेंशन कर रहा हूँ क्योंकि कई बार होता क्या है कि हम बेसिक चीज़ों को समझ नहीं पाते हैं, बिकॉज वी डायरेक्टली जंप टू दोज पार्ट वेयर द क्वेश्चन हैव बीन आस्क्ड. Actually, question definitely is going to be asked from the pharmacokinetics, but enzyme concepts and that initial basic things will be always in the question. And what happened, I have seen while solving the question that most of the students, they don't know what does it mean exactly. Okay, so quickly I'm gonna give you the basic knowledge, and then from the next video I'll move to the exam based pharmacological concepts, and together parallel we will solve the questions also. Now, I told you about the introduction in my first video of the introduction of the pharmacological, and then I told about the enzymatic kinetics, and then I told you about enzyme concept in the pharmacology. So now that was three things you should remember, and now we came back over to the basic thing, about the topic which says, that is pharmacology. We study about the drug activity, but here what kind of drug is given, that I have told you, that is depend on your pharmacological effect. But similarly there is a substance, right? So how you have to give it, that path is known as route. Okay, so that is known as route, drug route, from which path you have given that drug. That is important. Why important, I will discuss. There are three types of route to give the drug. The first one, enteral, the second one, parenteral, and third one, that is includes others. Enterals names, if you take as a trick, that is, it is going to the internal system, and we take it through the mouth, and that is basically two type, oral and sublingual. There are sub kinds of tablets which we just keep below our tongues so that they can give the effect. Like we also take the vitamin C tablets as a vitamin C supplements, that is prescribed as sublingual. And in oral form they have basically two divisions. The first one contain enteric, and the second one extended release. Enteric release and extended release have the separate their properties. I will give you their information, because every time in the questions you will just use it, you will see the term, but definition will be nowhere. Enteric simply means that you are taking that drug, and that drug is going to be dissolved inside your gastrointestinal system, GIT system, right? And the extended release means there is some kinds of formations which have been added with them, so that they can show their effect after some time. Enteric have one of the best example is erythromycin, or you can say the antibiotic. Antibiotic have been prescribed to you, and that starts showing effect while it passes through your gastrointestinal system. And extended release, they have a capsule. Okay, they have they have encoded capsules. So what happened, that they goes to the because I think you guys know that our stomach have the acidic pH, and our intestine have the basic pH. And in the pharmacokinetics, I will tell you that same medium is always helpful to dissolve drug. There are some factors to absorb the drug, that later I will discuss. And because same medium is responsible, so that happened. That time what happened, that the pharmacological formation of that drug is important on the behalf of their activities. So where we want that particular effect. Suppose that we are giving an antibiotic to a person, and we know that there is a intestinal colon infection. Definitely you would like to give that drug which directly goes through the stomach and it do not dissolve in the stomach and go to the intestine and show their effect there. So what you will do, you will choose that drug which do not dissolve. It means that it should give their effect in extended form, right? So that moment we gave the extended release, and somehow, or you can say there is some kinds of arthritis, or you are going to prescribe some medicines, and you want it to be slowly effect. Okay, so there is maintenance dose, loading dose, and also distribution. All things are different, and I will tell you in my next video. So just basically as a rough concept, keep in mind that enteric is given when you want effect in your GIT level. Okay, and extended release is given when you want their effect over your whole body. Suppose that you are having pain in your leg or in your hand, so you have painkiller. So painkillers are the best example for them, and somehow drug abuse is always given. I mean, it's very famous as oral morphine. That is also a form of the extended release. The parenteral is very famous, and I think everyone knows. Just I will not describe for that. That is intravenous, and that is intramuscular, and that is subcutaneous, and that is intradermal. Okay, intravenous most of the times, NaCl and all these drugs you have seen, but I tell you that intravenous means directly you are going to give it to the vein, and it have the highest rate of effect. Bioavailability, that I will tell you later, that just you remember it has the highest rate of effect, and subcutaneous is the lowest. Okay, and now the last one, that is other form, that is oral or rectal or topical. Means you have inflammation over your hand or limb, just you have some kinds of paste you are using, that all comes in the other form of the drug route. Okay, now drug has been given to a person who is having a pathological damage, or you can say there is physiological abnormalities. Now the next step is, what is drug activity? I mean, that drug activity, which kind of activity will be shown when you have given some kinds of drug. And I told you in my first video that drug activity have been studied is in the two forms. These are the very famous, known as the branches of the pharmacology, pharmacokinetics and pharmacodynamics. Okay, kinetics means when you have given a drug, and now the very first drug start its activity. The first one, it has to be absorbed. Where it absorbed and how it absorbed, we will see in next video. Just I gave you the small rough idea. Absorption may be active, or I will choose the black because the same color. Yep. So absorption may be active, or it may be passive, or it may be facilitated. Okay, then distribution is basically did with the blood, okay, and blood plasma, and that is somehow known as systemic circulation. Metabolism, very famous from the biological concept of view, in the biochemistry. Three organs: liver cells, kidney cells, and other tissue. Basically liver is involved. Okay, elimination: kidney in the form of urine and feces, kidney in the form of urine and feces. Okay, I will go one by one in the pharmacokinetics. Just here I give you roughly to understand, and I would like to end this video by the first definition of the pharmacokinetics. Pharmacokinetics is known as the drug effect over the body. Okay, study of drug effect over the body, and pharmacological have the basically four divisions: absorption, distribution, metabolism, and elimination. And the definition of the absorption is this is the study of the drug activity from the site of the administration to reach systemic circulation in the blood circulation. And keep in mind that all this, even pharmacokinetics and pharmacodynamics, they are subsequent process. It doesn't mean that first absorption will take place, then distribution. They are parallel. Absorption take place, distribution take place. So you can't say you don't have a proper time. Yes, there is absorption is occurring. No, it may be possible that somehow some cells where this drug reaches earlier, so there is absorption, but when later it is not absorbing because of saturation. So these are the concepts, because it is happening inside the body, and you cannot pick one word and say yes, this time this happened. Okay, so hope you guys like this video. Like, share and subscribe the Inspiring Minds coaching, and I'm educator here, and I will explain you remaining things, and I welcome your questions. Whatever you have, you can comment in the comment section, and keep watching our channel, and later I will give you the more trick to solve the questions.